In 2024, the United States spent $14,885 per person on healthcare, the highest healthcare cost per capita across similar countries. Switzerland was the second highest spending country with $9,963 in healthcare costs per capita, while the average for wealthy comparable countries, excluding the United States, was $7,371 per person. So America spends roughly twice as much as its peers on every person per year. 8 in 10 Gen Z Americans report that medical expenses put at least a moderate stress on their budgets. That's nearly twice the share of baby boomers who say the same, even though older individuals are more likely to require greater care. And 1 in 4 Gen Z adults actively skipped a doctor visit in the past year because they could not afford it. Let that sit. You live inside the most expensive healthcare system ever constructed in human history. You are contributing to it with every paycheck. You will contribute to it for the next 40 years. And you, personally, right now, can't afford to use it. There is also a program called Medicare that you are currently funding through your wages. The Old Age and Survivors Insurance Trust Fund is now projected to be exhausted in fiscal year 2032. This is roughly 1 year earlier than was estimated before. The CBO estimates that this would result in an immediate across-the-board benefit cut of 28% in 2033, the first full year after exhaustion. And the most recent legislation passed by Congress, the One Big Beautiful Bill Act, would accelerate Social Security and Medicare insolvency by a year, to 2032. It did not fix anything. It moved the problem faster. So here's the punchline question. I want you to actually sit with it. You are being charged every single paycheck for a system that is running out of money, that currently doesn't serve you, and that will deliver you a diminished version of itself by the time you actually need it. Why are you still surprised by any of this? Look, this video is not a rant. I don't do rants. What I'm going to do is walk through exactly how the healthcare funding system in this country works, mechanically, and explain why the incentives built into it are almost perfectly designed to transfer wealth from young, healthy workers to older, sicker retirees. Not because anyone is evil, not because there's a conspiracy, but because that is what the structure produces. We're going to explain how the system works and why it's getting weird. To do that, I need one metaphor. The metaphor I'm going to use is this: a subscription service you never agreed to that auto-renews every 2 weeks directly from your paycheck, that charges you more every year, that you cannot cancel under any circumstances, and that is quietly planning to downgrade your plan right before you finally qualify to use it. That is the entire thing, and we are going to use that lens to examine every layer of this problem. Next, let's start with what you are actually paying and where it goes, because most people do not know the real number. Every paycheck you receive, before you see a dollar, before your 401k contribution, before your health insurance premium, 2 taxes are taken out that most people glaze over completely. Social Security at 6.2%, Medicare at 1.45%, total 7.65% gone before your net pay is calculated. Your employer also pays that same 7.65% on top of your wage. So the full economic cost, which employers factor into what they are willing to pay you, is 15.3% of your total compensation going to these 2 programs before anything else happens, not after. Before. Now, here is the critical thing about the Medicare portion specifically. That 1.45% you hand over, it does not go toward your own future health care. It goes right now, today, this month, to pay for Medicare benefits for people who are currently 65 and older. The money deducted from your paycheck in February is being spent on someone's hospital bill in February. This is not a savings account. There is no account with your name on it. It is a real-time, continuous transfer of funds from current workers to current retirees. This is what economists call a pay-as-you-go system. The subscription metaphor fits exactly. You are paying a recurring fee, and in return, you get access to nothing right now. The benefit you receive, if everything goes reasonably well, is access to that same service roughly 40 to 45 years from now when you are old. You are prepaying for a service that will not be delivered for 4 decades. To be fair, that design made sense when it was built. When Medicare was established in 1965, there were roughly 5.1 workers paying in for every one retiree collecting. In 1950, there were 16 workers per beneficiary. In the early stages of the program, the math worked. The subscription had enormous numbers of subscribers and very few people actually filing claims. The revenue base was massive relative to the payout obligation. Now look at where we are. Today there are just 2.9 workers per retiree, and this amount is expected to drop to 2 workers per retiree by 2030. The program was stable when there were more than 3 workers per beneficiary. 2. By 2030, that means each working person will be essentially carrying half a retiree on their back financially just to maintain the current payout level. And that ratio is going to keep falling because the decline in the worker to retiree ratio is a direct result of 3 concurrent and sustained demographic shifts. The large cohort of individuals born between 1946 and 1964 began reaching retirement age in the 2010s. The sheer volume of this generation moving from the contributor column to the beneficiary column accelerates the reduction of the ratio. The overall longevity of the American population has also increased notably. People are living longer in retirement and consequently collecting benefits for a greater number of years. And then there's the birth rate. Fewer people being born now means fewer workers in the system 20 years from now. The pipeline is narrowing from both ends simultaneously. When Social Security was originally designed, the full retirement age was 65, and average life expectancy at birth was somewhere around 63. The original actuarial math was built around a reality where many contributors would never actually collect. That is no longer the reality. The system was not updated to match the new demographic reality. It was just kept running at the same parameters while the world changed around it. This is not a political complaint, it is a structural observation. The subscription model worked at 16 subscribers per claimant. It is cracking at 2.9 to 1. It will fail at 2 to 1. But here is the part most people skip entirely when they think about this. The ratio problem alone would be manageable if healthcare costs were growing slowly. They are not. Medicare spending grew 7.8% to $1,118 billion in 2024. Meanwhile, the payroll tax rate, your subscription fee, has barely moved in decades. The cost of the service is accelerating. The subscription price is approximately flat. At some point, the math simply stops working. The long-term healthcare inflation rate is projected at 5.8%, compared with projected Social Security cost of living adjustments of 2.4%. So the cost of healthcare is growing at more than double the rate at which your future benefits will increase. Every year you wait to retire, the gap between what you receive and what your healthcare actually costs gets wider, automatically, without anyone doing anything wrong. Just the compounding of 2 mismatched growth rates over time. You think the problem is that the government is mismanaging the money? But actually the problem is that the pricing mechanism inside the healthcare system is fundamentally broken. And that broken pricing mechanism is consuming the funding base of a program that was already demographically stressed. 2 separate failures compounding each other. Let me give you the bigger number because the per capita spending figure deserves more attention. Despite spending twice as much on healthcare per capita, utilization rates for many services in the United States are lower than other wealthy comparable countries. Prices, therefore, appear to be the main driver of the cost difference between the United States and other wealthy countries. Let me unpack what that means. We are not doing more procedures per person than our peers. We are paying more per procedure. The volume of healthcare is not dramatically different. The price tag per unit of healthcare is dramatically different. And because the price is high, the total spending is high, and a larger and larger portion of wages, taxes, and government revenue is being consumed by this one sector. The United States spends over $1,000 per person on administrative costs, approximately 5 times more than the average of other wealthy countries. $1,000 per person per year just to manage the billing. Not treatment, not medicine, not surgery. Billing infrastructure, insurance reconciliation, prior authorization processes, denial and appeal workflows, coding systems. $1,000 a year per human being. Healthcare now accounts for 17.6% of US GDP, a figure that is expected to grow to 19.7% by 2032. Nearly 20 cents of every dollar produced by the entire American economy directed toward healthcare. That is an extraordinary number. And the trajectory is upward, consistently, year after year, regardless of what policies are in place. Now, why does this matter specifically for Gen Z? Because when you are 22 or 26 or 29 years old, you are statistically the healthiest demographic in the entire system. Your expected healthcare utilization is extremely low. The actual cost of insuring you is a fraction of what you pay in. But the subscription fee, your payroll contribution, is set at the same rate for everyone. You are paying a fee calibrated to fund a population that uses vastly more healthcare than you currently do. There is a concept in insurance called adverse selection. When healthy people leave an insurance pool, the pool gets sicker on average, costs go up, more healthy people exit, costs go up further. It is a self-reinforcing collapse. The individual mandate in the Affordable Care Act existed specifically to prevent this. It forced young, healthy people to stay in the pool so their excess premiums could subsidize older, sicker people. The government was explicit about this trade-off. The government knows you are the subsidy. That is not conjecture, that is documented actuarial architecture. Younger people tend to be healthier populations, and thus less in need of treatment for the often expensive conditions that come with aging. Yet healthcare costs are disproportionately likely to strain a young consumer's household budget. You are paying a lot in, using very little, subsidizing others, and feeling the financial pressure anyway. That is a particular combination of outcomes that should prompt some clear thinking. Evidence of financial strain comes from data showing that young consumers pay out of pocket for more than 1/3 of their treatment costs. So on top of your mandatory payroll contribution, on top of your insurance premium, when you actually go to the doctor, you are covering more than 1/3 of the bill yourself. 3 layers of cost. 3. If you want to stay in the loop on how these systems actually work, and more importantly, how to position yourself around them, subscribe to the channel. That is what I'm building here. Not motivation, not life advice, just clear analysis of systems that affect your money. Here is where it gets darker. The Old Age and Survivors Insurance Trust Fund is now projected to be exhausted in fiscal year 2032, 6 years from now. When it hits zero, the program does not shut down. It continues paying out at whatever rate current payroll tax revenue supports. Upon insolvency in 2032, Social Security beneficiaries would face an across-the-board benefit cut of around 24%, permanently. Automatically, no vote required. And a lot of people hear that and think, okay, 24% cut on retirement checks, that sounds rough but manageable. But that framing misses the full dimension of the problem. For a healthy 65-year-old couple retiring this year, lifetime healthcare costs are projected to total $661,812 in today's dollars, or $955,411 in future value. Nearly $1 million. For 2 healthy people who retire today at 65, 84% of lifetime Social Security benefits for such a couple will be needed to cover healthcare expenses. For younger couples, that share rises to 104% or even 129% of their expected Social Security benefits. Read that again. 129%. If you are in your mid to late 20s today, the current trajectory suggests that every dollar of Social Security benefit you ever receive will be consumed by healthcare costs. And you will still owe money on top of that. Your entire lifetime of mandatory contributions, taken from every paycheck, buying you a benefit that pays for your medical bills and nothing else. And that assumes you collect the full promised benefit, which the Insolvency Timeline suggests you won't. The long-term healthcare inflation rate is projected at 5.8%, compared with projected Social Security cost of living adjustments of 2.4%. In 2026, Medicare Part B and Medicare Advantage premiums deducted from Social Security rose 9.7%, while the Social Security cost of living adjustment was 3.2%. This is not some distant theoretical risk. It is already happening to current retirees, right now, this year. The healthcare cost growth is eating their benefit before they can spend it on anything else. For Gen Z, that process will be further along by the time you reach retirement age, and you will have lower real benefits to start with. The machine is running away from you while you're on it. Now, let me address the political piece, because this is where most people get distracted and upset. I want to be analytical here, not emotional. There is a massive gap between the way Americans understand how entitlement programs are funded and the way they are actually funded. Many people believe there is effectively a trust fund that was raided, that the money was spent elsewhere, and that this is a result of waste, fraud, and abuse, not that it's a problem inherent to a pay-as-you-go system. That is the wrong frame. The structure itself is the issue, and the structure cannot be fixed without someone accepting a cost. The political system is designed to delay choosing who accepts that cost. The CBO cited 3 primary drivers of accelerating insolvency dates. Provisions included in recent legislation that reduced revenue to the trust, higher than expected spending in Medicare, and demographic shifts showing a more rapidly aging population and a slowdown in the growth of the number of workers paying payroll taxes. 3 drivers, all structural, all moving in the wrong direction simultaneously. The Social Security and Medicare trust funds are in trouble, and as of late, politicians have only made the problem worse. Both presidents, Joe Biden and Donald Trump, signed legislation that will accelerate the insolvency date of the Social Security trust funds. This is a bipartisan failure. It is not a Republican problem or a Democrat problem. It is an incentive problem. The people who benefit most from the status quo vote at high rates. The people who bear the future cost of the status quo are younger, vote at lower rates, and have less political organization. The political equilibrium is therefore to protect current beneficiaries and defer the adjustment onto future workers. Every reform cycle follows this same template. As one political analyst put it, Americans fall into 2 different camps: those who want to do something about it and those who want to push this off to the next generation. The second camp has been winning for 30 years. Here is the official government plan for Social Security solvency as best I can tell. Congress will address it at some point through bipartisan cooperation when sufficient political will emerges. They have been planning to do this since roughly 1994. It is going wonderfully. Let me make this concrete with actual numbers, because abstract percentages are easy to dismiss. Imagine you are 24 years old, you just landed a salaried job at $55,000 a year. That is a realistic number for early career workers in this demographic. Your payroll taxes for Social Security and Medicare come to roughly $4,200 a year from your portion alone. Your employer pays a matching $4,200 on top. Total economic contribution to these programs per year. From your employment, approximately $8,400. You never see any of this money. It disappears before your net pay is calculated. Now run that forward. You work from 24 to 67, 43 years. Assume no salary increases for simplicity. Just to keep the math readable, your personal payroll contribution over your career totals approximately $180,000. Employer match, another $180,000. Total economic contribution, $360,000 in today's dollars, not accounting for wage growth or tax rate changes, both of which will increase the real number. What do you get back? Based on current benefit formulas, someone with a median earnings history can expect roughly $1,800 to $2,200 per month in Social Security at full retirement age. Call it $2,000 a month, $24,000 a year. But here's the adjustment. Upon insolvency, Social Security beneficiaries would face an across-the-board benefit cut of around 24%. So your monthly check is now roughly $1,520, annual benefit around $18,000. And now we fold in the healthcare cost trajectory. For younger couples, the projected share of Social Security benefits needed to cover healthcare rises to 104% or even 129% of expected Social Security benefits. So your benefit check, already cut by 24%, is then absorbed in its entirety by Medicare premiums, supplemental coverage, deductibles, and out-of-pocket expenses. Net income from Social Security after healthcare costs, approximately 0 or negative. So the ledger looks like this. You contribute $350,000 to $400,000 over your working life to these programs. The projected return on that contribution after the benefit cut and healthcare cost absorption is approximately 0 net purchasing power for actual living expenses. Now run the alternative. You take $4,200 per year, your portion of the payroll contribution, and invest it in a diversified equity portfolio earning a conservative 5% annual return over 43 years. That compounds to somewhere around $550,000, an asset you own outright, one you can pass on to your children, one that compounds in your favor, not against you. I am not arguing for privatizing Social Security. I am describing what the math produces. The expected financial return on your forced participation in the current system is at minimum significantly inferior to a basic market alternative, and that gap will be larger for Gen Z than for any generation before them. Most people think the problem with Social Security is that it might run out of money. But actually, the problem is that even in the scenario where it doesn't run out, the structural return for young workers has been quietly deteriorating for decades. The system was a better deal for your grandparents than for your parents, and a better deal for your parents than for you. That trajectory does not reverse on its own. Number 1. So what actually happens next? Let me walk through this clearly because I want to leave you with a realistic picture, not an anxious one. There are 3 levers available to repair a pay-as-you-go system that is running out of money. You raise the contribution rate, you cut the benefit level, you change eligibility criteria primarily by raising the retirement age or tightening qualifications. Every option imposes a cost on someone. The political system's response to this has been to delay choosing, but delay has its own compounding cost. The longer you wait, the more severe the eventual adjustment needs to be. Demographic shifts showing a more rapidly aging population and a slowdown in the growth of workers paying payroll taxes means the pressure only builds over time. There is no scenario where waiting makes the math easier. What I think realistically happens is a combination of all 3 levers, applied gradually and disguised as reform rather than acknowledged as cuts. Retirement age increases, phased in slowly. Some version of means testing or benefit formula adjustments. Incremental payroll tax increases framed as program stabilization. Some version of this happened in 1983. The political window for doing it opened only when the crisis was visibly imminent, and the solution was structured to protect current retirees, while shifting the burden of adjustment onto younger workers who would feel the change decades later. If a similar deal happens again in the late 2020s or early 2030s, which is my best guess at the likely scenario, the people who are 55 or 60 today will be substantially protected. The people who are 25 today will absorb the adjustment. That is not an accident. That is how these reforms have always been designed. And then there is a second-order effect that almost nobody discusses. As fiscal pressure on Medicare intensifies, there will be sustained efforts to find savings by squeezing provider reimbursement rates. Hospitals get paid less. Physicians get paid less per Medicare patient. Fewer providers are incentivized to accept Medicare. The quality of care accessible through the program quietly declines, even if the headline benefit number stays nominally the same. You can receive a benefit check and have nowhere to spend it effectively because the providers have exited the market. There are many possible factors for why healthcare prices in the United States are higher than other countries, ranging from the consolidation of hospitals, leading to a lack of competition, to the inefficiencies and administrative waste that derive from the complexity of the system. And none of those structural causes are close to being resolved. The administrative machinery will keep consuming its $1,000 per person per year. The consolidation will continue. The prices will continue rising. The subscription is still active. It is just being downgraded without notifying you. And here is the piece that ties the whole picture together. Your private health insurance, the coverage your employer provides or what you buy in the marketplace, is also experiencing rapid price escalation at the same time. Employers renewing fully insured health plans for 2026 are facing average premium increases of 18 to 25%, with some groups seeing hikes exceeding 60%. Plans available through the ACA marketplace will go up by an average of 18% in 2026. Certain people with lower incomes may see their costs go up by 75% or more. So let me count the layers here. The program you are forced to fund through your paycheck for your future is becoming insolvent. The healthcare funded by your taxes for current retirees is experiencing out-of-control cost growth. And your own private insurance, the thing you depend on right now, today, is also becoming dramatically more expensive at a pace that significantly outstrips wage growth. 3 separate problems, all accelerating, all pointing in the same direction, all landing on the same demographic. This is not one broken system. It is 3 misaligned systems producing a compounding burden on anyone who is young and working. You know what is genuinely impressive about this situation? There are people who think the reason healthcare is expensive is because young people aren't meal prepping enough. Like the solution to $1 trillion structural insolvency is adequate hydration and consistent sleep. Look, I am not saying those things do not matter for your personal health. They probably do. They do not fix the balance sheet. Okay, let's close the loop. We started with a simple, uncomfortable observation. You live in the most expensive healthcare system on earth, you fund it involuntarily. 8 in 10 Gen Z Americans report that medical expenses put at least a moderate stress on their budgets. Nearly twice the share of baby boomers who say the same, and the programs that are supposed to serve you when you're old are heading toward insolvency within 6 years. The subscription you're paying for is getting more expensive, the coverage is being downgraded, and the company is heading toward a mandatory restructuring before you qualify for benefits. 3 practical things to do with this information. Number 1, remove Social Security and Medicare from your retirement projections entirely. Treat them as unknowns. Whatever you collect, if anything, should be a surprise bonus on top of your actual financial plan. Your real plan has to be privately owned assets that you control. Roth IRA contributions, 401k maximization, taxable brokerage accounts, hard assets. The people who will be insulated from what is coming are not the ones who built their retirement around government program promises. They are the ones who built an independent financial infrastructure that does not depend on what Congress does in 2032. Contribute aggressively to whatever tax advantage structures exist. Compound time is genuinely the only structural advantage you have right now, and it decays with every year you delay. Number 2, think analytically about your healthcare exposure today, not in 40 years. The largest near-term financial risk for someone in their 20s or early 30s is a single uninsured or underinsured medical event. A broken arm, an appendectomy, 1 hospitalization, a 4-figure or 5-figure emergency bill sitting on a thin savings balance cascades into years of financial setback. You do not solve this by wishing the system were different. You solve it by understanding your actual coverage. Know your deductible, know your out-of-pocket maximum. If a high-deductible health plan with a health savings account is available to you, take it seriously. The HSA is a triple tax-advantaged vehicle that the system has not yet closed off to regular people. Contributions are tax-deductible, growth is tax-free, and withdrawals for qualified medical expenses are tax-free. It is one of the few remaining legitimate asymmetric advantages available to someone without institutional access. Number 3, update your model of how political systems handle financial problems. They do not fix them early when fixing them is efficient. They fix them late, under pressure, in ways that protect the most politically powerful stakeholders and shift the adjustment cost onto whoever has the least leverage. That is not cynicism. That is a documented historical pattern. If you expect reform to come in time to fully protect your interests, you will make financial decisions based on promises that will not be kept as structured. If you model the more realistic scenario, you make different decisions with your savings rate, your asset allocation, your career trajectory. The people who are surprised when these programs are restructured will be behind. The people who plan for an impaired version of them will not be. The system is not malfunctioning. It is doing exactly what its incentive structure produces. That is actually a useful thing to understand because it means it is predictable. And predictable systems can be navigated. If that kind of analysis is useful to you, subscribe. I will keep going.